Okay, good day to Dr. Lagrada and my fellow classmate. Today, I'll be presenting the final phase or phase 4 of my supervised practice in hospital administration presentation. So these are the table of content. The first three presentation earlier, I've talked about the healthcare organization of my choice, which is Hospital Shah Alam. The current directional strategies include mission, vision, and core value, the top three management problems, and then the internal and also external environment analysis, and also the SOR analysis. So for phase 4, I will include worksheet 11 and 12, where I will translate all my earlier analysis into a targeted actionable intervention to address a major issue affecting Hospital Shah Alam service delivery. So let's go for the first worksheet 11, which is the problem 3. So through a systematic analysis of the internal and external factors, I have identified high patient load and long waiting time in the operation department as the most critical management problem. So in this problem 3, I structured the contributing costs into internal and operational factors and also the external/systemic factors. So internally, we face staffing shortages, inefficient scheduling, underuse of the telehealth, high referral rate, outdated medical equipment, and also overcrowded facilities. Externally, the challenges include a growing urban population, rising NCD cases, employment instability for healthcare workers, and also budget constraint. So all these factors combine to create a serious consequences at the patient level effect, staff level effect, and also system level effect, which range from reduced satisfaction and delayed care to staff burnout and reduced morale, and also diminished hospital performance. So let's move on to the worksheet 12, which is on log frame analysis. To directly address the issues, I propose a project called the Smart Queue project, which stands for Strengthening Management and Access Through Responsive Telehealth and Queue System Enhancement in Hospital Shah Alam OPD. This is a targeted initiative to reduce outpatient congestion and improve patient care by integrating digital queue management and also telehealth services. So the first on the log frame analysis is the goal here. So the goal is to improve our patient service efficiency and enhance overall patient experience in Hospital Shah Alam. So here we aim for 85% satisfaction, reduce average wait time to less than 60 minutes, and also to maintain more than 90% staff retention. To measure this, we will use tools like the Patient Satisfaction Survey or PSQ18, monthly OPD audit report, and also the human resource records. As for the resource assumptions, we are counting on sustained policy support for digital health and crucially, the buy-in from hospital staff to adopt the new workflows. Without this, even with the best system that we can design, it may not deliver the desired outcome that we want. Next on the purpose. So our purpose is to reduce OPD congestion and enhance the quality of care by implementing a digital queue system and scaling up the teleconsultation services. So we are implementing two solutions here. The first is the teleconsultation services, especially for follow-up cases, and a digital queue system. The performance target here are more than 10% of the OPD follow-up transition into telehealth, and more than 80% of clinics actively using the digital queue system. So we'll verify this through the OPD service utilization record, system access log, and also the monthly IT report to ensure proper functionality. However, we have to assume that patient will have the adequate access to mobile and internet devices, and that our staff are digitally trained and confident to use the systems. So these are important success factors that we watch closely. Next on the result, so we are expecting 4 concrete results from this project, which are a working queue and also appointment system. Telehealth system will be available in at least 2 specialties. 100% of the target staff are trained in digital tools and also a patient flow SOP formally being adopted. So we can confirm this through procurement records, clinic pilot reports, staff training attendance sheet, and also approved administrative documentation. But we must anticipate risks such as the IT system downtime, no significant IT or vendor delays, and also budget constraint for the equipment and training. So all these factors can stall the implementation. So we need to be prepared with the contingency plan and timely coordination, which are essential. And lastly, on the activities. So our activities are structured into the 6 stages from A1 to A6 here. And it will be done within 6 month time. The first month for conduct workflow assessment, and when we go into month 3, we will install the queue system for it to go live. Month 4 to 6, whereby the pilot teleconsultation and SOP being finalized, and beyond 6 months is to training and also awareness campaign being completed. So monitoring tools here will include the project implementation plan, MNE checklist, and also feedback from both the patient and staff to guide improvement. Here we assume that timely procurement has also smooth system setup and also active support from the clinical team. Cross-departmental cooperation also will be critical to ensure that each milestone is being delivered on time. So as a summary, through a comprehensive assessment of Hospital Shah Alam, I've identified high OPD patient load and long waiting time as a critical challenge. Using the SWOT approach and problem analysis, I propose the Smart Queue project, which is a strategy intervention focused on telehealth and digital queue integration, aligning with our vision of a resilient, patient-centered, and digitally enabled public hospital. So with that, I thank you and I open for question. Thank you.